Darren, 3 of the top 4 manufacturers of amoxicillin are having trouble keeping up with that demand right now. Hartford Healthcare's vice president of pharmacy describes the drug we're talking about, amoxicillin.
It's one of the most commonly used antibiotics in the United States. It's a first-line treatment for many pediatric bacterial infections.
Eric Arlia got the FDA notification about the shortage of amoxicillin. He explains what the agency does.
They try to work with manufacturers. They'll look and see if there's any additional manufacturing capacity available.
He says the FDA will also put out information on the other antibiotics like Augmentin that doctors can prescribe instead of amoxicillin. The nationwide shortage is in the liquid suspension version, a go-to for treating kids' ear and throat infections. Arlia points out that antibiotics only work on bacterial infections, not viral infections like RSV. Health experts are seeing many illnesses going around already this year, why supplies of amoxicillin are so in demand. He says, listen to your pediatrician.
If they don't really think an antibiotic is warranted for your child, if we really are in fact going to be tight on inventory throughout the winter, really try to heed their advice and not insist on one.
He says right now Hartford Healthcare's amoxicillin supply is good. Arlia points out one important part of this shortage. It is not like the baby formula shortage, which was because of a safety issue at a factory. This shortage is different.
Hopefully, it's really just a supply-demand thing.
And he urges parents to talk with their pharmacist about dosing and medicine concentration. Make sure you know how to give the correct dose because it may change when different drugs are prescribed. Lisa Carberg, News 8.